And we're back with Crystal, Vivi, and Laura in the unfiltered conversations of aesthetics. Let's talk about it. All right, guys. So we're back on our epi. First of all, thank you to everyone who submitted. I mean, so many submissions.
We had like what, over 100?
Over 100.
I was shocked.
I don't know, but it was a lot. And
you guys have some crazy stories.
Crazy.
Can't share all of them, so we're gonna have to.
We knew it was crazy, but one of the ones that kind of stood out to me, she was a patient of mine, was the overfilled story. Oh my goodness. God bless her heart. We had someone in her 80s who went to a surgeon to correct some eye bags, and he put 4 syringes.
Stop.
4 syringes of HA filler in her face.
In her face
tear troughs.
In her
tear troughs.
In her under eyes alone?
In her under eyes alone.
I barely do.
And I remembered this patient. I'm so glad she reached out. And I actually had seen her in office recently, but whoa, she was a mess. She had, the worst part was that he had told her he couldn't do anything about it.
What?
So she was looking disfigured, and she went back to this doctor, and he said, oh, well. And so she was a shut-in for a year. She was a shut-in in her own home in her 80s for a full year because she couldn't go to lunch. She broke up with her boyfriend. She couldn't be seen. And she went into my office, and I felt around, and I was like, where did you get this done? She said, America. And I was like, okay, is it filler? She said, yeah. And I was like, okay, unless this is silicone or some sort of insane substance that should have never been put here, then we can dissolve. And this woman burst out into tears. Completely burst into tears and was just so happy that there was hope. And I dissolved her eyes, and then we did some microneedling, and she's back going to lunch with her friends. And she came back into my office a few weeks ago, and she was kind enough to submit her story. But that breaks my heart. Like, as an aesthetic provider, like, to take away someone's life.
Was it a physician that did it?
It was a doctor.
That's crazy.
And I would love to call him and just let him know Hylenex exists.
Yeah.
You can
get it at your pharmacy.
They're really, I have a lot of plastic surgeon friends. They're excellent at what they do, cutting. And some of them are really good at injectables. But the ones who just add injectables on as an extra stream of income and not realize that it's a very finicky subject and field to get, to start doing without the proper agents for dissolving or fixing. Those are the ones. I've had to fix so many botched lip fillers from plastic surgeons alone. And that kind of brings us back to what we talked about before.
We don't hate on doctors.
Absolutely not.
Yeah. And I think it's not that modality or that person can't do it. It's just that they don't every day. Yeah. I'm pushing product all day, every day, sometimes Saturday.
They do surgery.
And that's what they're.
Yeah. I would suck at a facelift, unless I learned how to do it, which I wouldn't do in the United States as a nurse practitioner.
But that's the thing, is knowing when to refer to your surgeon colleagues and knowing when you can do injectables. That's a huge part of what we do, right? I say, like I said, I told you before, I say no a lot. And I say, you need an upper bleph, for example, or you need an under bleph. I cannot fix this for you. Mm-hmm. You need a facelift. Nothing I have here is going to fix that, right? And I've had a lot of referrals from plastic surgeons in the area. So the ones who know their specialty truly in and out get it, right? They know that they're going to send or to their own provider in the med spa to do those injectables, and then they're going to get the surgical patients because that's what they're good at.
Or take the time to hone your injectable skills the same way you did your surgical skills, and then you're good to go.
That's not what they went to school
if
for.
They want to do that.
But it's
you know what I mean? Well, it's questionable. They went for a cosmetic, surgery.
They know anatomy in and out. So they know the anatomy, and they probably know, where to inject and stuff, but they don't know filler and what tissue plane unless they've studied it.
It's just like playing the piano. Like, I would want someone who plays the piano all day to play for my party than someone who's like, I learned how to play piano. I think I can do it. Let's do it. That's going to sound pretty shitty.
Yeah. The overfilled industry too has caused some issues for all of us, I'm sure.
Yes.
I've had patients who walk in the door and I'm like, and they want more. And I'm like, I can't do that for you because now my name is going to be on the end result of that. Even though the before work wasn't me, it was someone I didn't agree necessarily with their perspective of beauty on.
Yep.
And I can't touch your face, So it's sad.
And that also leads to patients who have filler phobia.
Yeah.
Right.
And which is hard because we are not injecting the same way as we did even 5 years ago, where you were heavily pushing a specific brand that pulls a lot of water and makes your face a lot more stiff. Whereas there's newer versions of filler that is more dynamic, more natural, and just kind of educating patients on that we are going away from all of the overfilled pillow faces.
Yeah.
And even the ones that love that look, it's kind of hard to reel them back in and say, yeah, no, that actually looks really bad.
But there's a provider for them that will do that.
That is true.
It's just not us.
So you just, and I always say, choose the provider that you want to go to. And I
Their
always say
looks.
their looks and their
So important.
face is a definition of
Their
what
beauty
they
perspective.
consider as beauty.
And it's huge. I mean, I think most people come into my office and mention that as new patients who say, you know, it's not even about being pretty. It's just they feel safe looking at me, looking at my girls, looking at their lips. Like, I tell you what, like, it is a new employee initiation that we dissolve lips when you start working for me. Like, they come in the door and I'm like, you now represent me, and we have to dissolve
like
it.
that.
It's not a mean thing. It's just they need to look normal,
More natural.
and correct.
No, I agree.
Normal and
Or even
correct.
like when patients are sending you like, because I always ask in my consultations, like, what is your ideal look, right? Because that kind of gives me an idea of what their expectation is for when we do provide them with this treatment plan. And if you're giving me a celebrity that has a filter and has all of these things, facelifts, Facetune, the whole 9 yards, I'm like, girl, I'm not the person for you. And you have unrealistic expectations because one, you're never going to achieve this. And whoever tells you that you're going to achieve this is lying to you. And second of all,
But you can go to Turkey and get a whole new face.
On TikTok.
Have you seen those?
No.
It's crazy.
Yeah, I don't know. They make like 7-year-olds look like they're 20 again.
Yeah.
Yeah. So, but yeah, just telling patients that like, no, that's not realistic. Yeah.
Educating. It's all about educating too, because sometimes patients don't know. They're just seeing these things on TikTok and Instagram. I did it before in aesthetics. I was like, oh my God, that girl's so pretty. How do I look like that? And then I learned about Facetune and Photoshop. And even with all that stuff, because there's mild edits on those apps, but then you realize the more money you make, the more beauty you can buy.
You really truly can.
Skincare.
You really truly can.
Skin resurfacing treatments, touch of filler for that natural look, other things on the market.
Biostims, I think, are the key to beauty. I mean, when I do facial balancings, I think if I'm doing 4 syringes, at least 2 of them, if not 3, are biostim fillers or PRF Easy Gel or something. And then we do lips and a little bit of cheek pop or whatever we need with the HA. But I feel I'm moving super away from HAs throughout the whole face, which I just think there's better modalities to serve that. Chin shadow, Easy Gel does incredible, especially if they'll let me inject it once or twice. I know you guys do a lot of chin shadow work, and I don't think it's wrong.
I love chin shadow
I
work,
think
yeah.
the way that we can improve someone's actual physiology with biostimulators is not just a filler sitting there looking pretty, which is great. But
how do you, for me, don't get me wrong, I love biostimulators in regards to using like PRF or like your own natural blood.
Yep.
But there's a certain stop point for my patients. Like if you are 50 and you want that, I'm going to tell you your results are not going to be that great.
Absolutely.
Compared to somebody who's in their 20s, who's got great blood, great nutrients in their blood to be able to reproduce.
I haven't had an issue. The studies on Easy Gel were done on people in their 60s. So unless someone is unhealthy truly or has a blood dyscrasia or a blood issue, we're not having an issue with it. I mean, in my experience, but I am doing I will do an Easy Gel kit, which gets me 5 mLs of Easy Gel. We put that eyes, back cheek for lift, nasolabial folds, chin shadow, and then I'll take 2 Radiesse and do face framing with that. So it's kind of like I wouldn't tell someone a kit of Easy Gel is going to save you from your 50s, but it is a combo treatment where I just feel like they do more long term than a filler that's just going to sit there.
Yeah.
Yeah. Well, I do think that ERF or PRF Easy Gel has its place. I don't personally use it. I don't like the studies around it. I don't like the studies around it. For me, Radiesse and Sculptra are my 2 biostimulators. Sculptra, obviously PLLA, you guys know that, and it's not giving any filling effect right away.
Right.
It's leaving what particles we inject on the skin, and that works on the collagen, elastin, fibrous matrices. So I like Sculptra in place of PRF Easy Gel because that gets me the biostim I need. And then when I need to fill, which I do fill, I'm not scared of filler. My patients aren't scared of filler. My whole face is filled and I look natural. And so I think if you do it in a tasteful manner,
Sure,
and knowing when to say no and stop, and then not only that, biostims and filler can't be the only way to youth. You guys know that. skincare and lasers. We all three have really good lasers. I use CO2 specifically, and that gets me the restructuring of the skin I need. Then biostims, and then filler for me is a Band-Aid. But it's actually like the icing on the cake, if you think about it.
Or like if someone needs a chin, I'm not going to put Easy Gel there. Like we're not going to fix chin recession with an Easy Gel kit, but a chin shadow support so it's not shadowing and having some
for that
volume loss
and stimulation.
But at the end of the day, it's really about multimodality.
Absolutely.
Doing more than one thing. And at the end of the day, it's not just about, getting one treatment done and that's it. It is a lifelong journey. A lot of questions patients will ask is, well, how often do I want to do that? Or how often do I have to do this? And I tell them, as long as you want to maintain it. It's like when you buy a car, your first initial investment, and usually the first initial investment of your treatment plan is going to be the most expensive.
Right.
But you still have to maintain. So just like a car, you still have to get an oil change. You have to fill up your gas. You have to maintain it. Your face and your skin still needs maintenance.
Every year it ages.
I'm aggressive with it. I'm like, you're decaying. Yeah. Like I'm decaying every moment. I use that word. I'm like, you are decaying by the minute. Your skin is shriveling up and dying. Like if you don't actively and aggressively stop it, you're not going to look the way you want at 60. And that's just, I'm sorry. That's the truth.
Telling my patients that you're decaying.
And all of them go, I know. Like they all agree because I'm like,
it's true.
It's funny and it's true. And a little shock value is kind of part of my fun.
I want to go back to what you said about multimodality and lifelong journey.
Yes.
I preach to my patients that I can only fix 20% in office.
Yep.
80% of your beauty journey
is you.
And it happens at home. Your water intake, your nutrition. Are you getting enough protein? Are you getting enough sleep? Obviously, we can't control stress, but you have stress management.
Are you following your at-home skincare regimen as prescribed?
It's 80% at home. Literally, all of what we do is the icing on the cake. We can help get it started, but if you're investing thousands of dollars in what we do, I'm not even beginning you on a laser package unless you can prove to me you can wear sunscreen for 4 weeks in a row and follow your skincare protocol, because I'm not going to get the results I want.
But that's a struggle. Like I had bad acne when I first started injecting. I mean, I wore makeup thick my first year because I'm like, people are looking at me as someone who they want to aspire to somewhat their goals to a certain degree. And I'm breaking out with acne. And it really took SPF. Like, did I do a bunch of lasers? Did I halo the shit out of myself? Did I do all these things? Yes. But did I also
80% of what you
wear
do at home
SPF every day from the minute and
you didn't wear sunscreen before?
I didn't wear sunscreen before.
I didn't either.
Until I was an injector. I wore zero. I was baking. I'm a Florida girl.
I mean, so was I, but like I at least wore like 15 SPF.
Nothing.
Mine was in my makeup. Like my patients come tell me, it's in my makeup. And I cringe inside because I'm like,
that used to be me. I thought that CC cream with 25 SPF was fine. And it's better than nothing. But
I agree.
And layering it is even better. But I didn't. And then all of a sudden my acne just slowly started getting better because of that beautiful esthetician who really just kind of looked at me and said, you gotta wear some sunscreen, girl. Like, it's not that hard, so.
Out of the multimodality treatments that you guys do, what are some things that you do that are off-labeling, right? Because off-labeling is also something that we do all the time with injectables. So let's say, for example, Dysport. Dysport is only FDA approved for the glabella. And that means that they just did the study on that. They can prove that X amount of units will give you this duration.
This is a good shift because it's going to bring us right into our PDGF conversation, which I know everyone is on the edge of their seat for.
Can't wait.
So what was the question?
So like talking about off-labeling, right? Okay. So like normally off-labeling, and we do this in aesthetics everything that we do. So in medicine in general, let's say, for example, a medication that would be prescribed for a diuretic is indicated only for you to remove the excess water in your body, but we also use it off-label to control your blood pressure. And same thing with like any neuromodulator or acne. Exactly. So same thing with aesthetics as well, too. We do Dysport in the glabella, but everywhere else is considered off-label.
Well, I think a little bit of like a vocabulary test is needed first. So like for people who aren't familiar. So off-label is fine, but it does require that you have a label at some point. And that is where,
For studies.
again, we're going to get into the PDGF conversation, but you can't say something is off label if it never had a label. So like, I think that's where people get confused, where it's like, off label isn't scary as long as the provider is prudent and ethically based, where you say, I have Restylane and I'm going to, well, iLight is now FDA approved, but before that, I was using Resti-L in the eyes with a little bit of lidocaine. That was beautiful, and that is not illegal. Like, that is not something I can't do.
Right.
Yeah.
But
It's
that
not illegal.
that is an off-label use of a on-label product. So what gets tricky is in the age of weight loss, the semaglutide compounding and all of that. Like, technically, I personally, correct me if I'm wrong, I know everyone will, I don't think those are off-label. Those are just us using a medication available, but they don't have approvals. They have approvals on Zepbound, but that's
They have approval on the brand name.
right, and
but
they
that's
paid
with
for that.
every pharmaceutical industry medications, generic versus brand name.
Exactly. So that generic title, like whoever's compounding that, you have a trustworthy pharmacy and we trust it. But if you don't have a trustworthy pharmacy,
Oh gosh, we can get into the
that's what I mean.
rabbit
Like,
hole
this is
on
a whole
peptides.
rabbit hole on that. But
Some people are buying peptides online and
That's what I
for
mean.
themselves and as med spas and selling them to patients for like $50 a month.
Yeah.
And they're ending up in the hospital because we have no idea what was in these medications.
because it's just getting crazy. And I think people, it's kind of like when COVID first hit, everyone's like, herd immunity. And I'm like, do you know what that means? Like, everyone's
your
walking
vaccine.
around, like, just like, you don't even know what you're talking about. Like, we'd be at parties and we're medical professionals and we have a bunch of IT techs and people who don't work in medical are just arguing about what immunity means. And like, it's the same thing right now with the FDA. I feel like no one really knows what's going on as far as consumers. And they're just coming in when they get scared on TikTok or when Google says something scary.
Or
And
someone
then
causes a complaint
we're
about a
having to do an
complaint.
hour lesson in what FDA means and what off-label means. And I'm going to, all right, you go now.
But no, that's good. That does bring us to our
This week was
our
a sore
juicy-
button with me,
yeah.
so I'm a little hot.
That brings us to our juicy topic of PDGF, you guys, which is specifically brand name we've been using is Radiesse.
What is PDGF?
So it's platelet, exactly what the acronym is. It's platelet-derived growth factor.
Okay.
Right? Initially, it was studied for diabetic foot ulcers, wounds,
In Korea
orthopedic
and other
wounds,
places.
things
yeah.
like that. And topically, it was excellent, right? We saw that you're recruiting the growth factors of your own skin, your platelets, your macrophages, your fibroblasts, neutrophils, and it's stimulating that process. And so that's how we were getting such good healing.
A tissue rejuvenator.
Tissue rejuvenation.
Proliferation,
Exactly.
yeah.
For layman terms, tissue rejuvenation by using this topical application. Aesthetic companies sometimes get greedy, right? The industry as a whole, we have seen, and it was starting to be pushed on Instagram and social media as the Hail Mary for the under eye rejuvenation. Right.
Mm-hmm.
So this comes with issue because that brings us back to the off-label versus on-label discussion. It was never on-label for injection, so it can't be off-label for injection in the under eyes. But
that was the word that was used, by medical professionals.
medical professionals in the industry, aesthetics especially, key opinion leaders were probably paid a lot of money to discuss how good this was for the under eye treatments. And it caused other injectors and patients and everyone to believe that this was what you should do for
Because
the
they're
under eye.
influencers
Gold
in
standard.
the industry.
Gold standard
And this
for
is
this.
gold
Yeah.
standard because it's safe. And I mean, don't get me
And this was a purposeful rollout.
Yes. And don't get me wrong, it's delivered beautiful results.
I love it. I hate how much I love it.
However,
It has.
it is so good. It is so good. However, the only problem that we have with this is that
It's so
if there
narrow.
is a complication,
Right. Yeah.
We don't know what to do.
Well, at this point, I love the product. Okay, PDGF BB, let's just call it that. I don't love Radiesse. Radiesse is only created when the HA is mixed with the fluid.
Sure.
That is not Radiesse. What we are injecting is PDGF BB, and what straight up pisses me off, honestly, is that all of these people that were top of the line saying, do this, do this. I am also a key opinion leader for Juvederm or for Restylane. And now I am for Radiesse, leading all of us to feel
This is safe.
this is safe.
It's what we should
and
do.
This
They've
is
been doing
accepted.
this for a while. There's
They are
been
showing,
studies. There's this and that,
telling
blah,
us
blah,
that
blah.
there's 10 years of data and giving us the links to it. And I'm reading it and I'm like, yeah, this looks pretty good. Like,
What about for injections?
you know,
Like the
yeah,
studies.
it looks
Yeah.
great, like whatever. And so that is the issue. And now all of a sudden, it did make everyone, including myself, who is not, no longer offering PDGF into the future as an injectable. We microneedle with it.
Topically, it's great.
I appreciate the conversation that was started because it made me question the key opinion leaders who we're not going to name by name, the lovely people on Instagram who were just like brigading forward for
Right,
it. But when I went on the website and I noticed back in February and March when they sold me this and I bought $10,000 and I have a rep telling me inject it, here's the dilutions, they had no disclaimers on their site. They had nothing about injectables. They just said this product's amazing. Starting in April, they start adding disclaimers that say, do not inject. Meanwhile, a rep is in my office telling me to. What the hell is going on? And that's why I don't offer it anymore, because I don't know what's going on and my patients come first and the safety is
Absolutely.
questionable on how this company is going to handle their business.
Yeah, and a lot of times we do things that you have complications from everything.
You do.
Botox, fillers,
But there's support.
lasers, not just support. We know how to handle and
We
treat
know how to
them.
correct them.
We know that's the difference between a good injector and one that doesn't know what they're doing is we can have vascular occlusions, all of us. It can happen to any
Yeah,
of us.
I've had one
We can
and I
have
handled it.
a ptosis of the brow. We can have a DLI hit and cause a crooked smile. We know how to treat that.
Right.
Of course, we don't want it to happen ever, but we know how to treat it. We know the studies. We know what to do. We don't know what to do when we get a PDGF
And
complication.
meanwhile, Dr. Lynch, who is finally breaking his silence, finally comes on Instagram last week or 2 weeks ago and goes, do not inject. This is for topical use. You finally
Legality.
break your silence and you further just push the injectors who went on your command
Right.
into the water. I got nothing for you. I got no money for you. I got no attention for you. I got no Instagram presence for you. I got nothing for
We
you.
have lots of other products that do just as great of things, which is
PRP
great.
gel?
You're using PRP gel. I do a lot of lasers plus
Yeah.
a little bit of filler for under eye. I know you
I think it was
PRP,
Dr. Dewan
yeah.
who
PRP is
did the.
excellent.
Didn't you send me that study, the side-by-side study by Dr. Dewan who showed Easy Gel versus PDGF?
Yeah.
And she
Similar results.
very
Yeah.
Similar results.
If anything, the Easy Gel looked better.
Yeah.
Her
Well,
studies.
it's safer.
Yeah.
Right,
It's
and
safer
we know
because
how to
it's
use
your own.
it.
Yeah.
Yeah.
But overall, PDGF is not a unsafe product. I want to
Correct.
make that clear.
Correct.
It has a lot of great benefits for it. It's been used for years and it's been studied for years in, again, wound care, ortho, dental, because it has a lot of good wound healing properties.
Mhm.
The only issue right now is we're injecting it into healthy skin.
Mhm.
Right. So then it kind of rolls into the dark. It's like, well, what happens if XYZ happens? If the patient has, a nodule or if it has swelling or it has redness or bruising or whatever it is, right?
Mhm.
Usually we know how to fix those complications. And just right now, there's really no support from those companies or their reps or the ones that are, key opinion leaders from them to correct those things.
Mhm.
And I think that brings us back to our high school popularity contest is why did you pick it up, right? Why did I pick it up?
Because
Why?
I thought I had to. It's
Instagram
like
made it the
cutting
thing.
edge.
Instagram makes it like
Instagram
new and
made it the
shiny.
thing.
Oh my God,
New
this
and
is so
shiny.
amazing. You should
Yes.
do this. Look at these
Yes.
phenomenal results. But it's like,
We're medical practitioners
Yeah.
at the end of the day, and we have to come back to our studying, our education, our research-based and evidence-based medicine. Because granted, what we do is fun, and people in other specialties probably think, oh, they're not doing medicine. We are doing medicine, guys. We can really mess up someone's
Right.
face and cause issues.
big time.
So it's really important that again brings us back to our point again and again and again. Vet your provider, do the research,
Right.
make sure they're doing the right things, make sure if they're doing something new, they know how to handle things and have good support from companies that are kind of providing the products for
Right.
them, So
Yeah. Well, we said it.
Yeah, we did it.
I mean, I still love me some PDGF.
I had PDGF here.
I have it in my under eyes. I love it.
I love it, but
I just
can't
don't
back
agree
the
with the
company.
way they went about
Yeah,
it.
I can't back them. There's so many good products out there, and for me, it's about. I mean, once I just get upset.
It's safety.
Like, yeah, I'm just
At the end of the day, safety is number one for our patients, you know, and if there is a issue, we need to make sure that we can correct it at the end of the day. So make sure you guys ask your providers what they're using, how they're using it, how do they fix complications, vet your everything. Do not feel like your provider will be offended if you ask these questions.
And also understand that if you get a procedure done, read your consent forms.
Yeah. Please read your consent,
read your
you guys.
consent forms. Like if we do something, make sure you know what you're doing. And if you have an event coming up, like you might be swollen, you might get bruised, you might have prolonged edema. There's all these things that might happen.
We do a good job of saying that, but patients don't listen always.
They do not listen.
One time I did a lip filler, and I'm so good about asking a patient if they have an event coming up.
Yeah.
I did it, and she was like, yeah, I can't wait to go to my friend's wedding this weekend. I about shit myself.
Yeah, I'm sure you did.
Thank God it was one of the ones where I only did a little bit, and so it wasn't that much swelling, wasn't much bruising, but you can still have swelling when you leave my chair.
It's just wild.
And you can still bruise when you leave my chair.
Imagine.
I was like, I looked at her, I'm like, did you not hear anything I said about swelling and bruising for 2 weeks? Up to
She
2
just
weeks.
wanted what she wanted, girl. She wanted that plum.
She's like, yeah, but I've had it before and I've never bruised. I'm like, that doesn't matter. My technique can be different from Yuvi's technique.
Right.
I can cause more
Or
micro
you had
injuries.
spinach last night.
Yeah.
Or,
Yeah. Whatever.
You never
Whatever
know.
it is. But
Well, speaking of leaving the chair, to wrap up our epi here, I knew this one would be a little rambly. What are we doing for EDC this weekend?
I'm not going this
I know
year.
I'm not going either. I love my boyfriend just enough,
You're
and I
not
have to go
an
to a
EDC
wedding
girl.
with his
My
family.
husband is obsessed with that stuff, but
You should just take him.
Take him for
he
a
took
day.
me last year. I was pregnant. I was pissed. He's like, we have to go.
Okay, you
I
need
sat at one of the like little pillars with like some people around me that are just vibing on whatever drugs they were on, and I was like, that must be nice.
You need a
I'm high on
redo.
growth hormone,
Yeah.
baby.
Yeah, exactly
Yeah,
what I was on.
literally.
And I was like, I told my husband, I was like, just go do whatever you want to do in those crowds. I'm just gonna sit right here. And it was cold, mind you. I was
No,
not
we're
happy.
rooting for Laura to take you to eat.
Yeah.
You
Get out there,
guys
Mo.
You
Get out
guys
there,
take-
Mo.
Yeah, but
I
no.
would be there Saturday
know.
if I was in town.
Yeah.
I love a good
I know,
electronic
this is-
festival.
I know. This is just the first year that I'm not going. So
Well, I'm
I
so
don't know.
surprised.
Growth.
I saw you last year.
I know. I have so much shit going on, and my mental health is not ready for it. So,
Yeah.
yeah.
Well, that's good.
Maybe I should go to Vibe Out. So if you guys have any issues or questions about PDGF or anything, DM us, let us know, and we can help guide you.
We are open book.
Yeah, we're open books, and we can help guide you in the right direction to answer all your questions and concerns.
And we don't hold back.
No. Well, Laura, especially
Especially
Laura.
not in the office.
Actually, yeah, especially Laura. She's the whole bag.
I'll tell you the brutal, honest truth.
All right, guys. Tune in for the
Bye.
next episode.
See you
See ya.